Me too.
Okay, I think we are live and in. Hello, everybody. Hopefully you can all hear me okay. Yes, I see some nods. That's great. We'll just give it one moment for more people to join as we're getting a lot of people coming in still. And then we'll kick off. In the meantime, I will share our slides. So hopefully everybody can see those. Yes? Great. All right, if it's okay with everyone, I think we will aim to make a start. Yeah? Got nods from around the room. Awesome. So, hi everyone. My name is Nason Maani. I'm a senior lecturer in Inequalities and Global Health Policy here at the University of Edinburgh and the Deputy Director of Local Health Global Profits, which is a research consortium on the commercial determinants of health. And it's my great pleasure to chair this webinar on Killer Tactics 2, Business as Usual, the new report produced by ASH, the Alcohol Health Alliance, and the Obesity Health Alliance on how the tobacco, alcohol, and unhealthy food and drink industries have used their killer tactics to undermine important public health policies since Labour have been in power. And I know many of you have direct experience of these kind of tactics and are working actively kind of at the coalface. So hopefully you find this a really interesting exercise. I'm certainly really looking forward to the insights from our speakers. So just want to start with a little bit of housekeeping. If you could please submit any questions and reflections in the meeting chat, we'll then come back to them in a Q&A session at the very end after all the presentations. And I'll be keeping an eye on the chat and sort of I'll be able to pick out questions or themes of questions to share with our speakers. This webinar is being recorded and the recording and slides will be shared online afterwards with attendees. If you have any issues, technical issues or anything like that, please post them in the meeting chat. Okay? So just very briefly, here's an agenda for our webinar today. So I've been asked to offer some introductory remarks to kind of scene set, killer tactics of what we know and what we don't know and what would be helpful. And that will lead into Elaine, who will introduce Killer Tactics 2 and the updated bingo sheet, which you'll then hopefully have to hand as you listen to the later presentations. So after that, we're going to hear from Halle Breed about how the tobacco industry has tried to undermine the Tobacco and Vapes Bill, from Katherine Severi about how the alcohol industry has sought to act on the new government's ambition on alcohol. We'll hear from Katharine Jenner at OHA on the tactics used by unhealthy food and drink industry. I'll offer some brief summary remarks and then I'll hand it over to you for the Q&A and we'll dig into your questions. So hopefully should be really interesting, very fresh look at what's happened since the election. So before that, I just want to offer some brief introductory remarks to set the scene, and then you'll be done listening to me, and we can dig into the other speakers' insights. And I've just been asked to sort of touch on two main areas to kind of help us think about killer tactics. And one is what we know about industry influence and how it works, and why it's so difficult to get evidence of industry influence and what would help. And I think it's worth saying at the outset that this is a seminal, this is a core issue when it comes to prevention and when it comes to kind of reducing health inequalities, because it operates in this wider context of power asymmetry, right? Particularly for the communities that are most harmed. So it's very important for us to understand this and to think about what we do about it. So let's start with what we know about industry influence and how it works. So first, I would say is we know what motivates these tactics. We know why the producers of unhealthy food, alcohol, and tobacco do what they do. We know that internally they're aware that their products cause harm or they're disproportionately reliant on a lot of that harm for much of their sales. They know advertising increases consumption, and they know the youth market is really important. We know, obviously, that they're motivated by profit, which is understandable. And within that, fear of litigation, because that could impact on profit, protecting from regulation, because that would also impact on revenue, and concerns about credibility and image, because that can impact, your ability to engage in partnership, to lobby, and obviously demand for your products. And it's a combination of those two things that are what lead to the tactics that we're going to be discussing today, right? Those are why these companies choose to create controversy and doubt about a product's role in harms, lobby against restrictions to evidence-based or restrictions that are evidence-based. They fund research on alternative causes, and they emphasize individual responsibility. And hopefully we'll see some real world current examples of that. And again, internal documents make this very clear. So the rare glimpses that we do get under the sort of hood of these companies is that they do think about public policy, not on the basis of what's evidence-based or on the basis of what's most likely to benefit or harm society, but purely on the basis of, will this impact our business and how likely is it to materialize? And you can see this internal document from Coca-Cola Europe, them literally plotting public policy on the basis of whether they need to prepare for it, monitor it, or fight back if it's very likely to materialize and it's very likely to impact on their business. And in this case, that includes things like sugar taxes, for example. We also know that we often see only the tip of the iceberg and that there's a great deal of planning and coordination behind the scenes. So this is another leaked document. This is from Philip Morris International from the mid-2010s. And this shows them kind of coordinating their opposition to a public policy. And you can see they talk about political intelligence gathering, about doing full political engagement, media relations, using their own people, third-party coalitions, and using these kind of hidden links to other organizations to kind of put them as front groups or them as the main kind of messengers, establishing a critical mass and mobilizing consumers, retailers, growers, using consultants effectively, and then even testing, market specific arguments like what works with different people, what are one-liners that seem to make sense, what legal opinions can we rely on, and what kind of threats or can we make in that regard. So we might see one piece of this, or we might see this in relation to one particular policy, but this is kind of the bigger iceberg that's kind of under the water. That's quite important when it comes to these hidden tactics. And that iceberg metaphor is part of the reason why it's so difficult to get evidence of industry influence, because much influence occurs in diffuse or quite hidden ways. So it could be through corporate social responsibility and proxy organizations. It could be through hidden or informal routes like lobbying, through relationships and sort of long-term planning in terms of people who have connections, then move into other departments or other roles, revolving door. It could include legal threats or actions, so the silencing or discouraging of certain perspectives or voices that are then not reflected in agendas or in policy. And it can include coordination across wide groups of stakeholders. And I'm sure many of you on the call will have experience of maybe lobbying through indirect routes. So maybe not through the Department of Health, but lobbying other departments in support or in opposition of particular policy goals. And this reflects that kind of profound power asymmetry with civil society, right? We're talking about immensely large multinational corporations or trade organizations that have just way more resources to throw at things and to ensure that they have bodies in the room at a whole range of different meetings and levels, local, regional, national, in the way that IAS can't sort of send people to, to be in all these rooms, in all these fora, in the same way. I think it's important also to say that part of the reason that it's hard to challenge this is because these tactics can lean on areas such as partnership or economic growth or education or self-regulation that are quite dominant and sort of supported by policymakers and resonate with the public as well. And so part of the way that this is challenging is because these narratives can be used in quite in damaging ways. And I think the last reason I think that is challenging is much public health research, we have to kind of share the blame for this, focuses on risks and individual exposure and behaviors rather than the companies causing those behaviors. I think we've spent a lot of time studying malaria parasites, but not mosquitoes, if that makes sense. Like we haven't thought about the vectors as much as we really should have. And when it comes to NCDs, we need to increasingly do the same. I think part of the reason that these are both killer tactics and that they're sort of quite perverse in a way is that things like individual responsibility narratives hide profound inequalities in exposure. So if you look at things like the clustering of unhealthy outlets, you see that they increase linearly with deprivation in a context like Glasgow, as this paper showed. And you can see that's true for alcohol, tobacco, takeaway, and gambling. And you'll see this in kind of the concentration of license outlets in a range of different fora. And I'm sure many of you who work in public health will be aware of this. By the same token, distribution of outdoor advertising, it's also disproportionately focused on lower income communities. So this kind of narratives of individual responsibility really hide just the scale of the power asymmetry that's at play here, and the fact that there really are sort of cumulative unhealthy environments that are being formed and maintained. And the other reason that is hard is because of the cumulative impacts of arguments and of the kind of stories that these companies tell. And I think that's important for us in advocacy to think about, because there are really strong parallels between how these different companies argue along the same lines. So, for example, emphasizing complexity, like we saw with lung cancer and cigarettes, they emphasized that it was all very complex, couldn't blame cigarettes, multifactorial. We see that in the context of food, obesity is very complex, you can't blame sugary foods. We see that in the context of fossil fuels. Earth's climate is affected by many variables, wind, ice storms, meteors, all kinds of things, including humans. So you can't blame us for climate change. And in our research in the US on firearms, it's exactly the same. Is there a cause and effect relationship between firearms and suicide? Nearly everything gets blamed for it. It's really complicated, so you can't really sort of blame us. And alcohol is obviously almost the archetypal example that it's about individual responsibility. It's complicated. We can't have simplistic best buys to address this. It's all very, very complex. And I think just in closing, it's worth thinking that even really acute direct harms can be framed in really positive ways, and that can be really challenging. So as many of you will know, if you just look at alcohol-specific death rates in the UK, those have really jumped, especially post-pandemic, in all regions. Yet, if you look at these kind of proxy organizations and what they say about that, in parallel, they'll be releasing Friday facts for policymakers and the public, where they talk about a decade of falls in alcohol harm in Northern Ireland, covering exactly that time span. And they're focusing on underage drinking and sort of claiming responsibility for those declines. So they're sort of saying, ignore the decade-long highs in alcohol harms. Let's focus on the decline in underage drinking, which is due to all our partnership efforts, obviously. And sort of this weird duality where harms are complex and multifactorial and nothing to do with us, but any positive impact is 100% due to the things that we're voluntarily doing. And you see a similar thing in the context of Wales, and we wrote about this in Lancet Gastroenterology at the time, this idea that really profound increases in harm can be accompanied with these sort of stories of progress, partnership, and positive development. So just in closing then, what can be done about these kind of things? Because these are, of course, really difficult, in part because of the pervasive nature of these kind of narratives and tactics, but also because of the power asymmetry, like the fact that it's not just the potency of these kind of messages, but it's also the dose. It's the fact that the dose can be really, really large. So what can be done? Well, I think a big part of it is making the invisible visible. And the historian Robert Proctor, who wrote a lot about the tobacco industry, and Philip Morris, made the case that essentially what these companies are doing is fighting three main risks. They're fighting the risk of public health regulation, they're fighting the risk of litigation, and they're fighting the risk of ordinary people learning the truth. Like those are the three things that they're struggling to oppose. And making the invisible visible is a really big part of that third one, of helping ordinary people understand the truth. So I think exposing these tactics and pre-bunking people so they're aware of them in advance and can empower communities and decision makers by exposing and sort of, yeah, like preparing people to anticipate these arguments. It can help move the focus upstream from individuals to companies, help the public see the cumulative impact of these tactics, and make the case for better governance, right? Like across the piece, to make the case that if we want health in all policy, then we need management of conflict of interest in all policy, because you can't really have one without the other. And the exciting thing is that we're seeing a real growth of acknowledgement among public health practitioners, the growth of advocacy coalitions, tools explicitly about educating policymakers, informing good governance develop here. And that's a really promising sign. And the new latest example of such a tool is here, which is really, really exciting. So those are just some introductory remarks to hopefully set the scene. And I want to now hand over to Elaine, who is a public health registrar at ASH, and who, as I believe, correct me if I'm wrong, it is your last day on your placement at ASH today. So talk about going out with a bang, mic drop moment, ending it with killer tactics 2. So huge congratulations, and please do introduce killer tactics 2 for us.
Thank you so much, Nason. And yeah, absolutely, it is my my last day. So yeah, quite a lot to get my head around today, but I'm getting there. So hopefully you can all see my screen now. Right, and I can see you. So yeah, I'm Elaine. I'm a public health registrar currently on placement at ASH, and I have had the great pleasure of working over the last few months on our Killer Tactics 2 report alongside colleagues from the Alcohol Health Alliance and Obesity Health Alliance. So I'm just going to really quickly run through kind of what's in the report, and then let my colleagues from across the different organisations give you a bit more detail. So just to start off with, how did we get here? So ASH, the AHA and OHA have been working together really closely for the last few years to highlight the collective impact across tobacco, alcohol and unhealthy food and drink. And in particular to kind of really bring attention, like Nason was just saying, to the common playbook of tactics that these three industries employ to disrupt health policy. And we know that collectively these three industries have a huge impact on health, a massive impact on the burden to the NHS, and ultimately to the ill health and early death of far too many people in this country. So just a little bit of the story of kind of how we got to Killer Tactics 2. So Killer Tactics 1, as we're now referring to it in retrospect, was published last year and was really all about kind of highlighting what those tactics are, kind of categorizing them, giving examples of how they're used across all three industries as a common playbook. And then obviously last year we had a new Labour government elected, and with that new government a kind of new hope for health policy. So lots of really important manifesto commitments across all three of the biggest killers. However, it's not all been plain sailing, and so what we wanted to do really through Killer Tactics 2 was tell the story of these three policy areas and how they have come under attack from big business over the period of time since Labour have been in power. And so just to give you a little bit of detail about kind of what the killer tactics are. So our first killer tactics report highlighted these 8 different tactics. So those cover denying and playing down evidence of harm linked to the products, positioning themselves as part of the solution, distorting the science about their products, distorting messaging about health risks and harms, using legal threats to delay and disrupt public health policy, using corporate social responsibility to signal their virtue at the expense of health and well-being, using proxies to communicate their messages without always being transparent about their funding, and then giving gifts, benefits and hospitality to MPs and policymakers in an attempt to win their favour. So there's been a lot of press coverage recently on how some of those tactics have been used, but I just wanted to pull this this particular headline out because it highlights that MPs themselves are concerned about the rise in this lobbying being targeted at them and their colleagues. And then also I just wanted to highlight that the public are on our side with this. So 83% of the public think that MPs should not be accepting this sort of hospitality from industry. So there's a broad consensus that this stuff isn't great, and it's important that we kind of keep highlighting it. So today we thought it would be a bit fun to play along with Killer Tactics Bingo, which is just a sort of fun part of the report. We've got this this bingo card. I'm going to ask Caroline to pop a link to it in the chat for you all. And we just thought that as we run through the different presentations today, you could kind of see how many of those tactics you can spot for yourself. So it's the 8 tactics that I detailed on the previous slide, plus some of the common claims that the industry use. And this is a lot of the things that Nason was highlighting, claims about their importance to the economy, about kind of whether any kind of health policy will lead to job losses, the kind of individual choice and nanny state claims, that sort of complexity issue that they often use to disrupt policy, arguing that they should regulate themselves rather than be regulated by government, and wrongly suggesting that education is better than regulation. So see if you can spot any of these as we run through, and I'm going to hand back to Nason to introduce our next speaker.
Thank you so much. I love this idea. I'm really excited. I've got my Killer Tactics 2 bingo card. I hope you all do too. Open another window. So to take us through the first of the kind of examples of killer tactics since the last election, I'm very pleased to introduce Halle Breed, who's a public affairs intern at ASH, to talk about how the tobacco industry has tried to undermine the Tobacco and Vapes Bill. So over to you, Halle.
Thank you. Hopefully everyone can hear me well. So yeah, I'm going to be talking you through some examples of how the tobacco industry has attempted to undermine the Tobacco and Vapes Bill in the last year or so. Despite positioning themselves as being supportive of a smoke-free future, the reality is that the industry is constantly trying to delay and disrupt this legislation. And this legislation will see an end to the tobacco epidemic in the UK. Could I have the next slide, please? Thank you. So just to give a quick overview, in the UK, we are fortunate that development of tobacco policy is protected from tobacco industry involvement by Article 5.3 of the Framework Convention on Tobacco Control. This means that the government and civil servants are not allowed to meet with any industry representatives on health policy. However, wider political parties and parliamentarians are not bound by this, and the industry does very often try to find ways to get around this. So on the Tobacco and Vapes Bill, the Tobacco and Vapes Bill will create the world's first smoke-free generation, which is also often referred to as a generational ban, which means that anyone born after the 1st of January 2009 will be unable to ever buy any tobacco products. It will also limit the advertisement and marketing of nicotine products and create a licensing scheme for the sale of tobacco and vapes, amongst other things. So for some context, this bill was first introduced under Rishi Sunak's Conservative government and then has been reintroduced under Keir Starmer's Labour government in November of last year. And on Monday, peers will sit down for the first day of committee stage for the bill. Could I have the next slide, please? Okay, so I'm now going to run through some examples of how the industry has attempted to weaken some of the measures in the Tobacco and Vapes Bill. So firstly, we can look at the written evidence submitted to the committee stage in the Commons. So 42% of these submissions came from companies that have been linked to the tobacco industry. And importantly, many of these submissions included typical industry policy proposals. So one common one is raising the age of sale to 21 for tobacco products instead of the generational ban, which would obviously significantly weaken the measures in the bill. Parts of this written evidence was picked up by committee members, with the links to the industry not always being very obvious. So although the committee did not approve any amendments that weakened the bill, it is clear that the industry are putting a lot of time into attempting to influence the legislation. Also, it's important to note that this is just a snapshot of what they have said publicly. We also know that there is always lots going on behind the scenes too. Could I have the next slide, please? Thank you. So some of that behind the scenes activity happens at political party conferences. So I'm just going to run through a few events that have happened over the last year, but we know that industry representatives are also doing soft influencing with dinners and drinks for staff of parliamentarians and parliamentarians themselves. So the tobacco company Philip Morris International were active at the Conservative Party conference in 2024. In particular, hosting a panel called No One Left Behind, How Do We Accelerate the UK Smoke-Free Future for Everyone, which you can see on the screen. And yeah, the attendees and speakers are there, but the important to note that YouGov did pull out, which is why they've been crossed out. At this panel, the Director of External Affairs for PMI spoke about what they claim are low-risk products, such as heated tobacco. It's important to note that heated tobacco is included in the generational ban, the smoke-free generation. So this is a clear attempt to position the industry as part of the solution in the move towards a smoke-free country. And these sentiments were backed up by former MP Steve Baker, who criticised the generational ban and made the argument that it restricts individual freedom, leading into nanny state arguments. Additionally, the chief executive of UK Hospitality criticised these proposals to extend smoke-free laws to outdoor hospitality settings, claiming it would harm revenue in hospitality. So importantly, the government had initially intended to use the powers in the bill to restrict smoking in outdoor hospitality settings. However, after lots of industry lobbying, they've done a U-turn on this and will no longer consult on that. And Wes Streeting himself admits that he lost the battle on this policy, despite 59% of people actually supporting it. Could I have the next slide, please? Thank you. So looking to Labour Party conference, Japan Tobacco International were very active just after Labour's election win. So in 2024, JTI funded a retailers panel, which was advertised as a discussion on the challenges of being a retailer. But in reality, this was an event to kind of prop up industry lines. They also have hosted a watch-along party for staffers to watch the Prime Minister's speech with a free drink, enabling the industry to be close to and attempt to influence the staff of policymakers. Importantly, JTI had planned 2 events at Labour Party conference this year, a watch-along party and an event on restoring Britain's high streets, but these events were subsequently cancelled after Ash coordinated emails to speakers, making them aware of the risk of appearing on an industry-funded panel, and we also complained to the co-hosts of these events. Could I have the next slide, please? Thank you. So JTI have also been active offering hospitality to MPs, which led to The Guardian urging MPs to stop receiving freebies from the tobacco, alcohol and food industries due to the concern that it would impact legislation. In 2024, former Conservative MP Giles Watling declared hospitality worth £351.02 from JTI. Subsequently, in May 2024, he tabled amendments to the Tobacco and Vapes Bill under the Conservative government, proposing a raise in the age of sale of tobacco to 21 instead of the smoke-free generation policy. It's often difficult to make a causal relationship between lobbying and activity. However, this is a really good example of how gifts have directly translated into an MP attempting to weaken tobacco control regulations. Could I have the next slide, please? Thank you. So in recent years, the industry has attempted to position themselves as part of the solution and have invested a lot of money and lobbying efforts into what they call lower risk products. And often these products get around regulation through various loopholes. So one example is heated tobacco. This is a product that heats rather than burns tobacco. And you may have seen advertisement for these products in supermarkets like Sainsbury's and Morrison's. The industry have claimed that heated tobacco is not subject to the same advertising laws because they're not subject to the same advertising laws as other tobacco products, as they do not produce smoke, which prompted the government to write to supermarkets to remove these illegal advertisements. And despite lots of uncertainty about the harms of heated tobacco, the industry have pushed for their exclusion from the smoke-free generation policy. The industry say this is because they can play a role in smoking cessation. However, there is currently no evidence to suggest that heated tobacco can play a role in helping people quit smoking. Could I have the next slide, please? So on this slide, we can see a Philip Morris campaign that they have created, which is called Not a Cigarette, which is urging the government not to include so-called better alternatives to cigarettes in the smoke-free generation policy. This is based on claims that heated tobacco are fundamentally different and can be a part of a harm reduction strategy, despite there being uncertainty whether they are actually less harmful. The industry are very keen for there to be an exemption to the smoke-free generation, which currently applies to all tobacco products for their heated tobacco. And we can see on the next slide how they've tried to achieve that. Perfect, thank you. So Philip Morris International have taken Conservative peer Ed Vaizey on an all expenses paid trip to Switzerland to visit their factory. Unsurprisingly, only 3 weeks later, Lord Vaizey submitted an amendment to delay the smoke-free generation in the House of Lords. There is also a surprisingly large number of peers in the House of Lords who have said that they use heated tobacco products. And although we haven't collected comprehensive data on the usage in the Lords, it does seem to be much higher than the population average, which provides a skewed view of the efficacy as a smoking cessation device. So make of that what you will. Thank you. So finally, another key area where we have seen a lot of industry attention is on the topic of cigarette filters. So cigarette filters were created by the tobacco industry to give a false sense of protection to smokers who are worried about the health risks. Filters have no health benefit to people who smoke, and they do not filter out any of the toxic chemicals that are in a cigarette. So in February 2025, Conservative MP Caroline Dinenage introduced an amendment to the Tobacco and Vapes Bill, calling for all cigarette companies to use biodegradable filters. So this amendment was backed by Green Butts, who is a company who is heavily linked to the tobacco industry, and they are also a manufacturer of these biodegradable filters. So this campaign secured marketing in The Independent, with no mention of the fact that ecologists have criticised biodegradable filters for being equally harmful to marine life. And there is also no mention that filters have no health benefit, which I think you might be able to see on the next slide, some of the campaign. Yeah. So that's the campaign that was in The Independent. So, importantly, the APPG on Smoking Health have recently hosted an event on this topic, and a lobbyist working for Imperial Brands tried to get an invite. They are very interested in this policy as it sits in a nice intersection of health and environment, so it's of great interest to parliamentarians. So just to conclude and round up, whilst the industry has been relentless with their input, the government has stood firmly behind the Tobacco and Vapes Bill. Ash continues to work hard to expose industry lobbying and provide parliamentarians with the tools and evidence that they need to rebut claims that are harmful for public health. That's everything from me. Thank you.
Thank you so much, Halle. Really, really fascinating stuff, and just incredible that they're finding all these sort of side routes in. So thank you. Lots of positive responses, as you can see from the audience. So I'd like to move on now, thank you, to Dr. Katherine Severi, the Chief Executive Institute of Alcohol Studies, to talk to us about the kind of alcohol industry equivalent, what's been happening there. Over to you.
Yes, thank you very much. It's great to see everybody today. If I'll move on to my first slide to give a bit of context. So as Nason's already mentioned, we've seen rates of alcohol-specific deaths increase since the pandemic. We've actually seen quite a longer trend of rising rates of alcohol harm, and the pandemic's really accelerated this issue. So between 2019 and 2023, alcohol-specific deaths rose 42% in England. So we're really, I guess you could say, quite an acute alcohol crisis at the moment in the UK. Now, with this escalating rate of harm, we do have a policy vacuum, and we've had no national alcohol strategy in England since 2012. Now, it's been very well documented in academic literature and policy reports that the last government's alcohol strategy, which included proposals for minimum unit pricing, was essentially dismantled following very aggressive alcohol industry lobbying. And there's a lot of papers that we can share with people if they're interested to track those events. But I think it's important to note that despite industry opposition, the governments in Scotland and Wales have been bold, and they have listened to the evidence, and they've introduced minimum unit pricing, and it's working. We've seen really brilliant results from Scotland, where it was associated after just 18 months with a 13% reduction in deaths. So this is definitely one of our #1 policy goals from an Alcohol Health Alliance perspective, because it's just got such strong evidence of effectiveness and evidence of having impact in the most socioeconomically disadvantaged communities as well. So move on to the next slide. This is the context. On the flip side, as has been very elegantly presented by Nason, we hear many positive stories from alcohol industry organisations, and we know that economic growth is the #1 priority of this Labour government at the moment. Therefore, we are seeing an awful lot of growth arguments put out by the industry, some really promising numbers about their contribution to the economy and the fact that they're, you know, such a broad employer. I think it is worth noting that alcohol harm costs society in England more than 27 billion each year. That figure somehow doesn't make it into the industry lobbying materials. And when the hospitality sector talks about what a great employer it is, jobs in the alcohol industry, in the hospitality side of things, are some of the lowest paid in the sector. And we did see a lot of objections from some of the big pub chains and industry associations to some of the government's attempts to improve working conditions for people. So increases to national insurance contributions, the living wage, etc. So there's definitely two sides to that coin. If we go on to the next slide. So the good news is that when the Labour government got into power, they fully acknowledged the alcohol harm crisis that we're facing. They identified addressing alcohol harm as one of their key priorities. We were extremely excited to learn that they were going to publish a 10-year plan for the NHS in England that would firmly shift away from sickness to prevention and was going to follow the evidence. We were very excited by this. We were very excited to see that leaked versions of the 10-year plan apparently included restrictions on alcohol advertising to explore options that will be similar to the restrictions that are imposed on HFSS foods. However, when the final plan was published, there was no mention of alcohol marketing restrictions, and this was after a very concerted, coordinated campaign from alcohol and advertising industry bodies who wrote dozens of letters to government officials across departments saying that this was going to have a detrimental impact on the government's growth agenda. So if we move on to the next slide. What was included in the 10-year health plan was a commitment to introduce alcohol product labelling. So this is a very promising move in terms of Nason's point about how we need to make the invisible visible. This will potentially inform consumers for the first time about the health impacts linked to alcohol. However, we know that this is going to be a key flashpoint and target for industry opposition and lobbying. We've seen our neighbour, the Republic of Ireland, introduce legislation for alcohol cancer warning labels and alcohol products, but after really aggressive industry lobbying, those plans have been delayed and set back by another 2 years. And I think what's really important to see as this debate unfolds is what is going to be the role of the alcohol industry organisation, the Portman Group, who are currently responsible for the self-regulatory process around alcohol product labelling. They have in the past stated their objections to mandatory product labelling. They say that their self-regulatory voluntary code is plenty good enough. We have quite good evidence to show that it is not plenty good enough, and the Alcohol Health Alliance has done is, well, currently undertaken an assessment of what information is on alcohol product labels. And I think that I might have won the prize for finding the smallest pregnancy warning pictogram at 1.5 millimeters wide. And it's quite sinister to know that that pictogram was significantly smaller on a bottle of wine compared to a bottle of Stella Lager. And if you think about the demographic of who's going to be more likely to drink Stella versus wine and the gender demographic of that, I think that that's something that really does need to be addressed through mandatory level playing field scheme led by government, excludes the alcohol industry, and that can ensure that everybody has the information so that they can make informed choices about their health. So if we move on to the next slide, the next policy moment whereby we've seen real influence from the alcohol industry has been a licensing policy task force that was actually established by the Department for Business and Trade, and not the Home Office, which is the responsible department for licensing. This task force was co-chaired by the Chief Executive of Green King and involved many industry representatives. Health representatives and directors of public health were excluded from this process. To my knowledge, I don't think the Department of Health and Social Care were even invited to participate, despite health being responsible authorities in licensing decisions. And the recommendations from this task force, surprise, surprise, were very much centred around deregulation, cutting red tape, and promoting economic growth. There was no mention in the task force report about the off-trade sector. It's all centred around pubs and hospitalities and keeping the cultural icons of the great British pub trade alive. And given that 75% of all alcohol sold in England is from a shop, convenience store or supermarket and consumed behind closed doors away from licensed premises, we think that that's a real major omission is going to do nothing really to address the high rates of alcohol harm that we're seeing. So just to let people know that the Alcohol Health Alliance is going to be responding to the government's call for evidence on these proposals. And we do have a template consultation response that we're very happy to share. So if people would like to receive a bit more information outside of this meeting on the licensing task force and how we can be responding as a public health community to try and ensure that these proposals don't undermine the democratic process around licensing at the local level, then we're very happy to share that. I'll move on to the next slides. The next initiative that's been announced by this current government is apparent plans to reduce the drink driving limit in England and Wales. So we currently have the highest drink driving limit across Europe, including with our fellow UK nations. So Scotland had lowered its limit in 2016. And this is a very well evidenced measure. And we've seen in recent years the numbers of fatalities from drink driving incidents increase. However, we do know that, again, this is going to be a measure that receives great opposition, very vocal opposition from the hospitality sector, framed as an issue that will really damage rural pubs. Now, I think that that's an interesting argument to position, given that road statistics show that rural roads are actually less safe and experience greater number of incidents and road traffic collisions than urban roads. So again, I think that this is going to be a policy where we're going to have to really try and protect the process from alcohol industry influence. And I think that beyond all of this, if we move on to the next slide. Thank you. I think that beyond all of this, I want to go back to the point that I made earlier, that it's actually 75% of all alcohol that is probably driving the majority of harm, and is certainly cheaper than that bought in the pub, is bought in the off trade. However, the alcohol industry lobbying and messaging that we see around economic growth and cultural heritage is always framed around protecting pubs. We need to remember, well, first of all, the British Beer and Pub Association is one of the most powerful lobby groups in the country, and the APPG for beer used to be the largest all-party parliamentary group in Parliament. I don't know whether in this administration it still is, but it's definitely one of the most supported. But the British Beer and Pub Association doesn't just represent little country pubs, it also represents some of the biggest transnational alcohol producers, such as Diageo, who do make Guinness, but they also make vodka, Diageo, Heineken, AB InBev, Molson Coors. And these are all very active lobby groups who are very opposed to public health regulations. And just wanting to give an illustration of how this conversation is shifted onto pubs that really would not be affected by some of these impacts. I've got here a quote from the chief exec of the BBPA in response to the reported plans that the government were thinking of introducing marketing restrictions in the 10-year plan. And I guess I'm really questioning, would a 9 p.m. watershed on television for marketing vodka and Guinness really kill pubs? Is it really, if you actually sit back and just think about the common sense approach? But pubs are the sacred cow, and every MP will have multiple pubs in their constituencies that are suffering at the moment. So this is really what we're up against in terms of the power imbalance that Nason mentioned around resources, but also the power imbalance in terms of the narrative as well. And I think it's time that we need to rethink some of our messaging to reclaim some of that narrative to try and influence decision makers. And then I'll move on to the final slide, which is really just to reflect that this isn't just an impact that we're seeing domestically. The alcohol industry are having really significant impacts on the global health policy making at the moment. So very recently, there was a UN high-level meeting on preventing non-communicable diseases and improving mental health. And the alcohol industry, as were other unhealthy product industries, were out in force, attending side events, lobbying government missions. Diageo even recruited an alcohol policy manager earlier this year. And the job description included within that advert explicitly stated that this role was designed to counter the influence of the World Health Organization and its NGO networks. So to be so, gloves off and open about their intentions, I think we're at a really remarkable point in history. And I do hope that by, drawing attention to these issues, equipping our partners with this knowledge, it will help us build momentum to try and shift the balance in the future. And I think that was my last slide. Thank you very much for your attention. I look forward to the debate after Kat's next presentation.
Thank you so much. Really fascinating work, and some questions come through in the chat, which is great. So I'm conscious of time. We're running a little bit behind. So I'll hand over quickly to Kat Jenner at OHA to talk about this in the context of food and drink, and then we'll go straight into the Q&A. Please, over to you, Kat.
Thank you so much. How's everyone getting on with their bingo cards? Are we nearly there? I want to try and get full house by the end, or else we'll be disappointed. So I'll try and whiz through mine. And Elaine, if you could just click to my click through my builds as well, that would be great. So I think the case for obesity has been very well established already. We know the harms linked to it, and we know that the big social deprivation factor as well. It's worth just stating up front that we know that food is not the same as alcohol or tobacco. We've had lots of discussions between the three of us of the proportionality of harms of these different things, but the tactics very much used are the same. And the same way, we don't have particularly one common, one enemy as it might be with the tobacco industry. The food and drink is vast ranging and does also give us healthy food as well as unhealthy food. So the messaging is harder to untangle. So we don't have a lovely 5.3 or acknowledgement of obesity harm in the same way we do for alcohol. But still, the government in their 10-year plan did manage to hold on to quite a lot of our recommendations in there and launched a moonshot to end the obesity epidemic. Wouldn't necessarily be our choice of wording, but there's definitely a huge intention of government to try and create some change there and some future legislative plans. So we're in a fairly positive space in that sense. Next slide, please. So thinking about some of the things that have happened over the years. So in the previous version of the killer tactics, we heard a lot about what had been happening with the advertising policy. This is to limit unhealthy advertising on TV before 9 o'clock and online at any time. And so this has been going on for a very long time. But during the passage of that bill, there were several amendments made that were going to really weaken and delay the proposals as well. If you click down, you can see the images there. Thank you. One very unusual thing that happened was the Lord Moylan and others, in fact, in the primary legislative time, put in amendments trying to exempt specific products from the legislation, saying that they were called healthy. And they used this example of the Grenade carb killer bar, saying that it's a high protein, low sugar bar, and really just trying to undermine and make ludicrous the whole advertising restrictions by pointing out specific examples. Luckily, we knew about that in advance. Next click down. We're able to identify the product that was being used and to be able to have one of our friendly peers do a great little speech, which I can share the link to, actually, saying that actually, yes, it's marketed and advertised as a healthy product, but is it a healthy product? No. I think it had as much saturated fat as 2 sausages and as much salt as a couple of packets of crisps. So that didn't end up getting an exemption in there, particularly for protein bars, but actually the resulting categories of food and drink is fairly limited to just those that specifically are known to contribute calories in children's diets. So that was the first thing of sort of trying to play down the harm. Next slide, please. And that has just continued in this new government as well. So the big thing that's happened is about brand advertising. So you'll know the experience of tobacco, that first of all, there was advertising allowed, that you could just advertise tobacco brand, but not the specific product. So some of us will remember the silk cut scissors going across the screen. And that actually developed over time to become a much more comprehensive ban on advertising for tobacco. We seem to have gone the other way here, whereas the primary legislation didn't actually explicitly rule out brand advertising. If you could click down, please. The companies, junk food companies, put in legal challenges, lots of lobbying, lots of complaints to say that actually you needed to specifically exempt brand advertising within the law. Government, the Ashley Dalton, the Health Minister, tried to come up with a sort of an appeasing message saying that we think, yes, brand advertising shouldn't be included and it's for the regulator to decide. That's the Advertising Standards Authority, but that was not enough. Lobbying continued. Next slide, next click down, please. Ministers caved in. Next slide, please. Not only is there an acknowledgement that brand advertising is now excluded, but it is actually in law. So in another alternative to tobacco, we've actually now got a legal exemption for brand advertising. And it's not just brands, as in, I'm going to say Cadbury's, but brand of a range of products. A brand of a range of products is anything that may have 2 or more flavour variations. So that could mean Cadbury's Dairy Milk Buttons, which comes in different formats and flavours as well. So as long as you don't show the specific product examples, it's a really broad-ranging exemption. Next slide, please. This issue about food being complex has always been used in food, as you might imagine. Click down, please. And we had some drama being called Porridgegate, whereby when the categories for the advertising got published, someone pointed out that actually porridge and crumpets would be included in the advertising ban. Now that is misrepresenting the policy. The categories are included, but no specific category is banned. It has to prove a healthfulness test. So if your porridge has got huge amounts of sugar in it, which many of us with Scottish heritage would say is not true porridge, then that would not be allowed. And actually hardly any of those products do exist on the market. So I had to do and many of us had to do a quick rebuttal to defend it. And we were in this very awkward position when you're having to defend policies, you're already slightly losing. So next slide down. So that's really stuck. And we're hearing this happening again with lots of different areas, particularly with extending the soft drinks levy as well, that they're trying to make it complex, trying to bring in ludicrous examples to make it seem as if the whole thing is not worth doing. Next slide, please. And another thing we've heard a lot on food, as you might imagine, that education is better than regulation. Now, normally that's translated into having school learning programs and such like, but this was a really unusual example being used directly by the lobbyist. It was the Advertising Association. If you click down again, the Advertising Association, in their response to the House of Lords inquiry, didn't just say that education was important. They said that healthy advertising campaigns have a greater positive impact on people's health than advertising bans and restrictions. There is no evidence to suggest that. I don't know where they got that idea from. There's been a few TV campaigns maybe trying to promote healthy eating, like Change for Life, and other things like Veg Power, which is trying to encourage children to have more vegetables, but none of them have been shown to be anywhere near as impactful or wide-ranging as actually restricting people from seeing unhealthy advertising in the first place. Next slide, Dan. And economy as well. We hear this all the time, as you might imagine. If you click the slides down. So local authorities have really struggled to bring in advertising policies by saying that it would actually harm the local economy of advertising. We saw with the we've seen lots of lobbying going on there trying to derail. I think someone from Bite Back might be here who can share the great work that they did and trying to own some outdoor advertising space that then got lobbied to be taken down. We've seen, for instance, on the Transport for London advertising ban, not only did threats of some £30 million of advertising revenues being turned down not work out, revenues actually went up, and now we're seeing only healthier advertising on the London Underground. So more of that, please. And just to slightly end on a slightly more positive note as well, multinationals have been threatening over planning permission for new sites for years. There's not a huge amount that we've worked out that we can do at the moment about existing fast food places, but the government have brought in changes to the National Policy Planning Framework that you can deny planning permission to takeaways if they're places where children congregate, where there's high levels of obesity, or where there's already lots of takeaways already. So just wanted to add on that really positive note. I think that's the last of my slides. Has anyone got full house yet? I'll pass it back to you. Thank you, Nason.
Thank you so much. Thank you so much, Kat, and to all our speakers for really amazing work, and obviously all of the behind the scenes work that goes into this kind of thing. So I don't want to spend any time wrapping up really, because I think the message is fairly clear. That there are sort of three messages that we really want to emphasize out of this. And I want to give some time just to deal with some of the questions that came up in these last few minutes. So we had a few questions in the chat, and I want to start with one that Chris Brooks asks, which is about framing. To what extent is it worth pointing out that stopping the state regulating effectively, or kind of nanny state arguments, doesn't lead to free choice, but leads to the corporate state, where in essence the businesses shape our choice environment? Does anyone want to sort of, would anyone like to take a go at this, like about sort of countering that kind of narrative of nanny state?
Well, of course, it's absolutely right. I mean, I think this is something as well. The public do not agree with that sentiment. If you ask them if they think about whether these measures are nanny state, they are absolutely not in agreement with that. They think the government should be taking a more interventionist approach. They do not trust companies, farming industries, to be making improvements on their own. And actually, I would argue that if anything, the public think that we're in a more neglectful state. So broadly, yes, agree. Anyone that can come up with the perfect way of presenting it, please let us know, because as I've said before, as soon as you start to explain it, you're already slightly losing the argument, and we need to try and get in there first with that argument. Thank you.
That's fantastic. And for anyone interested, Greg Fell has written a couple of blogs on sort of like countering the nanny state and that kind of language, which I thought were really good. We had another question, which is about the power of kind of pubs being portrayed as a cornerstone of the community on TV, and like the extent to which modern media is kind of influencing these kind of norms and this kind of like kind of fuzzy feelings around the kind of economic benefit of this kind of thing, and what you feel the role of the media is. I don't know if Katherine, you wanted to comment on this.
Yeah, no, I did say that. I mean, I think that the role of pubs in soap operas has probably been there for, representing our cultural norms for a very long time. But there has been some really great analysis of representations of alcohol in TV and film. And I would say that whilst the depiction of the pub as a community setting is probably not one of our biggest threats right now to public health, but the nudges around drinking and representations of alcohol in the home setting. So, whereas in the olden days, probably when I was younger watching television shows, people would be reaching for a cup of tea if somebody came round. But now there's an awful lot of, glass of wine as big as your head being consumed by, all hours of the day. And that's probably more of the reflection of the nudging. And we need to remember that these product placements within shows are paid for by somebody. So yeah, it's certainly something to be aware of, and there is a literature on that, and we happily share that with anybody who's interested.
Thank you so much. We just had two quick fire questions that came in, so I'll try to get to them before we close if I can. So we've got a question here from Andy Lloyd, who says CSR efforts are clearly designed to frame themselves as the solution, and gambling advertising is almost universally framed around this. I wonder if we do enough around the harm they cause, especially when these can end up echoed in well-intentioned behavioral comms from partners. So the question is, like, the tobacco industry never tell people to smoke responsibly, but there's clear evidence that this kind of responsibility messaging adds to stigma. So I was just wondering if any of you had any comment on the kind of whether we need to do more to acknowledge the negative impacts of these CSR efforts.
I'll happily start with that, because I think a really good example of this is alcohol industry and other industry funded schools-based education programs. So we are actually at the moment coordinating a bit of a campaign with colleagues at the London School of Hygiene and Tropical Medicine and the Coalition to End Gambling Advertising, to try and get the government to give really firm guidance to schools that they should not be accepting materials that are produced by unhealthy product industries, because we actually do have really good evidence to demonstrate that the materials that are being created are misinforming about the risks linked to these products. We've seen materials produced by Drinkaware that basically talks about how alcohol can make you happy, and the really kind of ill-framed materials. So if anybody wants to get behind that, that's certainly a really live example of CSR initiatives that are doing harm, and we're trying to do something about it. So get in touch on that one.
Thank you so much, Katherine. I'm conscious that we're kind of at time, so I think maybe just to respect people's time, if you have a question that wasn't answered, please feel free to follow up. As I mentioned at the outset, all these presentations are being recorded and will be made available afterwards as well. And there have been several kind of resources in the chat and also requests for resources in the chat, which is really good. At this point, before we close, I just want to say a massive thanks to Elaine for helping to organize this webinar, to Ash, to HA and OHA for all the work in the Killer Tactics report. Before we close, is there anything that you wanted to say in closing about next steps for Killer Tactics and where we go from here? Or are you happy to end it there, Elaine?
No, I think you've summed it up brilliantly there, Nason. Thanks ever so much for being such a wonderful chair.
It was my pleasure. Thank you, everyone, for all you're doing for health. I hope you find this useful. Huge thanks to our panelists, and see you all soon.